I'm interviewing Mandy Rempel about her job. So what is your job title?
What I do is I work for Boundary Trails Dental Center, and what I do is I'm a dental assistant, certified dental assistant, but I'm also a lab technician.
Okay, so what parts or what do you do as a lab technician?
As a lab technician, my role is to fabricate sports guards, night guards. I also make in-house crowns. It's an E4D machine that the dentist preps the tooth, and then I can scan it into the computer and design the crown and then mill it right there in their office. So it takes about an hour and a half, and the patient can leave with a fully restored tooth.
Okay, so what do you enjoy the most about your job as a lab technician?
As a lab technician, I enjoy um, getting a sense of developing my creativity side as opposed to like maybe paperwork or something like that. I enjoy working hands-on, and I enjoy working by myself. So I kind of self-motivated, and I get my work done um, as opposed to being a dental assistant and working side by side with a dentist and patients. I get more time in the lab to do my own thing.
What kind of education do you need to become a lab technician?
All right, so I'm not technically trained as a lab technician. I did go to dental assisting, and through the dental assisting, my employer trained me to do the lab work that he needed done in his office. And I've also gone to continuing education courses, which have been in Dallas and Montreal and Florida.
Okay. So how long have you been working at Boundary Trails Dental Office?
I've been there for the majority of my career. I've been there for 22 years, graduated in 1994 from dental assisting, but have been in this particular office for approximately 22 years.
Okay. What do you plan on doing after this job if you do anything after it? Are you just gonna stick with this job and retire, or are you gonna eventually move on to a different job?
This will likely be my job that I retire from. I would probably in the future look to do more volunteer work and do more traveling with my husband.
Okay, so what places are you wanting to go for travel then?
For travel, I've got a couple more places on my bucket list. Italy being one of them, more Europe bound, and just maybe some road trips. Go explore things that you don't know are there along the way.
All right. Now you're gonna show us cutting some.
Yes, I'm going to show you. These are Dawson Rempel's models. We took impressions of his teeth, poured it up in plastic, and vacuum formed this thin layer of plastic over top. This plastic is going to act as a bleaching tray. So he's going to get some bleach to bleach, do some take-home bleaching. So what I'm going to do is just going to show you how I just cut around here and get the bleaching tray ready. So just going to start with these scissors and going to free up the model by cutting around here. And then going to keep cutting here. So the material is really thin, it's really forgiving. It'll fit really good. And it also houses the bleaching material that will go inside, which needs to stay on his teeth for a certain amount of time to bleach his teeth. Let's just try on this side. I'm just freeing the model right now. Freeing the plastic from here. I don't want to distort it when I take it off, so I want to cut away the undercuts. And so now I'll try to take this off without pulling too hard in any one spot. There we go. So basically when we bleach the teeth, we're just going to bleach the front or buccal surface of the teeth. The back we don't worry about. So what I'm going to do is I'm going to scallop here, because we also don't want the bleaching material to rest on the soft tissue on the gums. So I'm going to scallop it, and then here I'm just going to keep it a little bit longer. All right, so we're all done trimming up this bleaching tray for Dawson. Basically, we've scalloped along the edges, so we don't want any of the material to ooze past and get on your gums or gingiva. So we've scalloped it on the buccal side, on the front side, and on the lingual side, the back side, we've just kept it normal because we don't put any solution there anyway. So if we take this off, after Dawson would brush and floss his teeth, make them really clean, he'd be ready to put the bleaching solution inside his bleaching tray. And basically he's just going to extrude a little bit from the syringe just on the cheek side of the teeth here, all the way along. And then onto his clean teeth, he'll put this and he'll keep it on for about an hour per day for about 7 to 14 days until he gets the whitening that he wants. That's it.
All right. Thank you for your time.
You're welcome.